There has been a deliberate and systematic attempt on the part of the majority in the House and the minority in the Senate to make it impossible for all Americans to receive quality health care. And some of us will not stand for it. We will stand up and fight for what is right, for what is fair, and what is just. Health care is a right and not a privilege.
Democrats today didn't hide their frustration with Republicans' sudden concern with fixing America's broken health care system.
It's a false choice to say it's Obamacare or nothing.
Are you serious, what you just said? Are you really serious? After what we have gone through, you can sit there and say that you had a legitimate alternative. After these years, we've gone through 44 votes, 48 votes now, of you trying to dismantle the legislation. You call that cooperation? I don't.
Republicans took their shots too, both inside and outside the hearing.
There is no way to fix this monstrosity.
How do you not know how many people have enrolled?
This is just an incredibly bad rollout.
You didn't read the law as Nancy Pelosi said you should.
The GOP will tell you it's not just healthcare.gov that's glitching. The entire enterprise of Obamacare is doomed to failure.
It's more than a website. It's because this law itself is born from an architecture, a foundation that is just not workable.
So the foundation of the law he's talking about is the system of healthcare exchanges. But the exchanges that Republicans are now railing against are the backbone of the very same system they want. That system is called the Ryan Plan.
You can either have Medicare as is, or you can have a federal subsidy so you can go out and buy your own. Is that correct?
In a Medicare exchange, meaning you have guaranteed coverage options within Medicare. You get to pick among these plans. They have to meet at least Medicare's criteria.
Yes, the Ryan Plan, which passed most recently in March, uses federal-run exchanges just like Obamacare.
It transforms Medicare into a plan that's very similar to the president's own health care bill.
So let's review. Obamacare takes everyone in the individual market and puts them on a regulated government-run insurance exchange one step closer to single payer, but not there. The Ryan Plan takes seniors on Medicare, a single-payer system, and puts them on a government-run exchange, one big step backwards. So if you think the rollout of a federal exchange for 7 million people is rough, remember, it is the official position of the Republican Party to add 50 million seniors to that. And the same Republicans who spent their day grilling CMS's top administrator.
You're saying the system right now is working?
That guy voted to put 50 million seniors on the system he's railing against.
I think this was designed for failure from the beginning.
He voted for the Ryan Plan.
There is a disaster of a rollout that's occurring.
And he voted to roll out an even larger federal exchange. Yes, every single Republican on the House Ways and Means Committee voted for a plan that would put 50 million seniors onto healthcare exchanges. So if, as conservatives say, the rollout of the Obamacare exchanges discredits liberal governance, it discredits the conservative vision, too.